Healthy Soch welcomes Dr. M.I. Sahadullah, who is the founder, chairman, and managing director of KIMS Healthcare Management Limited.
So what are the precautions you will suggest after the COVID phase, like after quarantine is over? What are the precautions to be taken by the patient?
See, the quarantine is a time when we are protecting yourself, because you are a primary contact or a secondary contact with someone. And so once the quarantine is over, you will continue to protect yourself because you are not kind of immune, because we are not still depending upon herd immunity, because that has not become an accepted factor in any part of the world. So we will continue to take the precautions of hygiene, mask, social distancing, and respiratory hygiene. So all that we have to take care, and as much as possible avoid contact with the community where the community spread is going rampant. India, fortunately, we are coming down in the numbers, and for a country like India, less than 20,000 per day is a really welcome news. So, but I will say that only because we are very strict in, uh, you know, the following the precautions, new hygiene system, uh, better than many Western countries, and that is where we have scored better. And I think that this habit should continue until either we are getting vaccinated completely or the disease is almost getting eliminated and the testing rate is becoming almost 1 or 2 percent.
Sir, is it necessary for a patient to go for the test again after the quarantine is over?
Yeah, I do not think so. I will say that there is no need for a test again after the quarantine. After the quarantine is over, they should not test. Only we do the testing at that stage when they have symptoms and fever and something which is continuing and not easily diagnosed, and that is the time we will suspect it. Otherwise.
When we talk about the vaccination, like we expect the vaccination anytime now. So, what do you think? When will it be available in India, and what would be the expected success rate?
I think if I am following the instructions of the government, the advisory of the government, I feel that it should be available by the end of January. And they also have come out with a very good list of who are the people going to be prioritized to be vaccinated. And that is extremely diligently done. And I'm sure that they are being advised by an expert committee. And that need to be followed. There are arguments that this group should be included or this group should not be included. Those opinions will be there always within the public, and also there will be even within the scientists there may be different opinion, but we have to go with one opinion for the country, and that's what we are doing. So, but in spite of all that, the number of people we have to deal with in India is I don't think any other country will be facing such a situation. So it will be the biggest vaccination drive in history in the world when India is doing it. So to get into all the people who are required, it is going to take not less than 6 to 9 months. And then there will be a rush of people who are going to definitely ask for vaccination without waiting for their line. And so organization of vaccine delivery will be a challenge to the government. So in my opinion, I feel that it should be very well thought out. A scientific body and the policy makers should together join together and should have many discussions. And I also earnestly hope that the private sector will be very actively involved, because 60% of the care in India in modern medicine is given by the private sector. So the private sector can efficiently deliver the vaccination, mass vaccination. And so there's a good scope for a public-private participation in this area. And I think the masses will benefit and the vaccination can be obtained earlier. The one other thing is, depending upon what vaccination we are going to use, there should be a chain of cold chain maintenance is required, and Pfizer vaccine, for example, needs like a -70-degree cold chain. So these are some of the challenges only the government can take over, and of course the private sector also will be definitely playing a part in it. Your question about the efficacy of the vaccine. Efficacy of the vaccine is still not determined in many cases, but it is the Pfizer vaccine is we are thinking that it is more than 90% efficient and effective, and the other vaccines are a bit lower, but irrespective, I think somewhere between 80 to 90% is there. But that is true with any vaccination, even previous antiviral vaccinations, that may be true. Nothing called 100% at all.
Okay. And sir, recently we have come across a news regarding the new mutation in the UK, right, which is called VUI, the new variant of COVID.
Yeah.
So, sir, what is the symptom and what are the effects and what are the precautions people should be taking who catch this virus?
I think the world is puzzled with the new variant mutant gene of corona. And usually when there is a mutation coming, always it indicates that it becomes less potent. So in fact, the mutation makes it weaker and weaker, and that's what we have seen with other viruses. But this virus is spreading very fast, so infectivity is increasing, but whether it will be more fatal than before is a question one has to wait and see. And I hope that it may be spreading fast, but not necessarily more serious. But if it is remaining to be serious, that will really will be detrimental for any country. So what we can do, then of course the question is there, the vaccination, is it effective against the mutant variety of virus or not? So far the understanding is that, like influenza vaccine, when there is a different, mutant are coming, the same vaccine is effective against the same vaccine is effective against the virus. So we hope that even in COVID-19, the vaccine should be effective irrespective of the mutant gene. However, the spreading, we do not want it. And that is why more than 20 countries already closed their flights and everything up on UK. Amazing. And so whether already the cases have traveled even before we know about it, like what happened to with the COVID-19, from China, it came all over. And so we are not sure about it now. But at the moment, at least for a couple of weeks, all the countries are closing on UK and try to prevent it. I hope that it will subside without another surge of pandemic across the world. Vaccine is expected to be the same, and vaccine is expected to be effective against even the genetic mutant variety. However, if the mutation is a thing in the virus, it will come constantly. It is going to be coming again. It will change, and other mutants also will come. So sometime we change the vaccine, but there should be enough time for that. In this pandemic, we are looking at time. A vaccine which usually takes 4 years to be prepared, we have prepared and ready for within a year. It's an amazing news, but at the same time, one wonders that all the aspects are looked at it, and the effectiveness and antibody formation is is assured. So I hope that the mutation will not cause much another disruption in this process. Okay.
Okay. Thank you so much, sir.
All right.
It was great having you
Thank you.
with us on the channel.
Thank you very much.